Sustainability meeting. Today is Wednesday, February the 5th. Council Clerk, will you please call the roll?
Calling the roll, Ms. Brown.
Here.
Mr. Jones.
Here.
Ms. Stevens.
Present.
Mr. Brady. Mr. Brady is absent. Ms. Simon. Ms. Simon is absent. There is a quorum.
All right, I have the minutes before us from the January 29th meeting. I'll make a motion to approve. Do I have a second?
Second.
It's been moved in second. If there are no questions, comments, or concerns, all in favor, please say aye.
Aye.
Aye. All right, if you read the first item into the record, please, Madam Clerk.
Resolution number 2020-0035, authorizing an agreement with Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County in the amount not to exceed $1,339,104 for fiscal agent and program administration services for the Early Childhood Mental Health Program.
All right, excellent. If you'll please state your name and give us a little bit of background about this resolution before us.
Thank you. Good afternoon. Rebecca Dorman from Invest in Children and the Office of Early Childhood. This is our early childhood mental health program, which is designed to serve children 0 up to age 6, along with their families, of course. And these are when the child has a need in the social, emotional, behavioral area. We partner with this on the Adams Board, who serves as the lead agency with us, who conducts the RFP process, and then we have 6 agencies who deliver the services: Achievement Centers, Applewood, Beechbrook, Ohio Guidestone, PEP, and our newest contractor is Pipeline to God. So these agencies provide a continuum of services from the prevention end of the continuum all the way to actual mental health treatment in the home. So it's both what we call consultation, parent guidance, as well as treatment. I'm pleased to say that while annually the county puts in $669,552. The Adams Board also contributes to the funding slightly higher than that at $672,930. So we are pleased to have this partnership in funding the program. In 2019, 951 children and their families were served. 63% were male children, boys, 38% girls. Most of the children served are in the age range of 2 to 4. And there's a reason why we see a drop-off at age 4. It's not because there are fewer problems. It's because at age 4, there's the possibility that the child would have a diagnosis that could be billed to Medicaid. Under age 4, the problems and the diagnoses usually don't fit into that diagnostic framework, so they can't bill Medicaid, which is why we established the program. But we do mandate that if it's a Medicaid billable service, that they certainly should use that so that we're the payer of last resort. So that's that age range is where they're old enough that you begin to see these emotional behavioral issues, but they're not, the agencies, even though they're Medicaid agencies, are not able to bill Medicaid. In terms of other demographics, 50% of the children and families are African American, 32% white, 18% other, half in the city of Cleveland, half in the rest of the county. The top 3 referral reasons are due to trauma, aggressive behavior of the child, or an inability of the child to self-regulate. We always have a waiting list for this program, and currently 62 children and families are waiting. We have a central intake and try to get services to the kids as soon as possible, but the need has always exceeded the funding. So with that, I can pause and get your questions.
As you talk about the funding, you spoke about the level in which the Adams Board comes in. Is this an increase, decrease, or the same amount?
From the Adams Board?
For the contract.
Oh, from us, it's exactly the same as it's been for many years.
Okay. And the Adams Board's contribution?
So they are contributing annually $672,930.
And is that an increase, decrease, or the same?
I believe that's the same. Yeah, as far as we know, that is the same. And I'm sorry, we were hoping we'd have someone from the Adams Board here, but
Okay.
I don't believe she's arrived, so yes.
All right. Okay, I'll open it up to my colleagues for questions that they may have. Going once, going twice, all right. Dr. Dorman, you get off easy on this one.
And it's the first one. We were sure you were going to ask a lot of questions.
Do you need this moved under second reading suspension? It
That
looks
would
like
be-
it would be because
would
the
be
contract
great.
has
Yes.
started. So I will make the
Okay.
motion to move this under second reading suspension to the full body of the council. Do I have a second? It's been moved in second. If there are no
Thank
further
you.
questions, comments, or concerns, all in favor, please say aye.
Aye.
Excellent. Council Clerk, if you read the next item, please.
Resolution number 2020-0036, authorizing an agreement with Cuyahoga County District Board of Health in the amount not to exceed $1,042,124 for program administration services for the newborn home visits program.
Welcome back.
Hi, Rebecca Dorman again from Invest in Children. This is our Welcome Home program. So this is a single registered nurse home visit from the Board of Health, which is both the lead agency and service provider for this program. It occurs during the perinatal period, so immediately following birth. And the target population are families on Medicaid, but they will also visit a family not on Medicaid if there's a risk factor, such as domestic violence, a very young teen mom, etc. So during the visit, the nurse conducts a head-to-toe assessment, medical assessment of the newborn, as well as addressing maternal health concerns, including maternal depression. The nurse will also do an environmental scan of the home, looking at such things as for evidence that there might be lead paint, looking at the sleep environment to alert the parent to and family if there are any issues that look that need to be addressed there. So the moms are approached while they're in the hospital and offered the program. And then when they leave the hospital, there's a subsequent call scheduling of the visit to the home. And we just literally, hot off the presses today, were able to look at some data for 2019. So just to share with you that of the medical issues looked at in the mother, I was startled by this, that there was high blood pressure was found in 812 of the 1,300, roughly 1,300 moms. So clearly, high blood pressure was a big concern for these moms. In terms of mental health needs and depression, postpartum depression in the moms, the nurses referred 468 moms to get mental health services to address their mental health needs. In the babies, the top medical issue was jaundice in 268 of the babies. 30 sleep hazards were found. They distributed 25 pack and plays, which are, the portable cribs, to address that, as well as in other cases talking about risks that might be in the sleep environment, like if there's a bumper on the crib and things that we know it's not a bare naked crib. So just to give you a sense that while it is a one-time visit, the nurses will also do a follow-up call if they're concerned. They make these referrals, they make this environmental scan, and at times, even during the visit, they've identified a real urgent health issue in the mom. I know in one case an extremely high blood pressure where they had to tell the mom, you could stroke at any moment. We need you to get medical care, etc. So it's one visit, but I think it's a really important visit, and it's having an impact. So I'll stop there and let you ask your questions.
Okay.
And we do have Board of Health here if you have specific issues that I can't address.
So if I understood you, these dollars serve 1,300 moms?
Yes, 1,363 moms got a visit in 2019.
Okay, and is the funding increase, decrease, or the same?
So this year, we were able to give a slight increase to the Board of Health of $64,000, and that is just to make them whole because they had been the funding had been flat for, I think, for a number of years, 8 years, and costs keep going up. And so they were utilizing their own operational dollars. We were able to switch dollars and put them, even though our total budget did not go up, Invest in Children's, we were able to switch some dollars around to make them whole. So this was a $64,000 annual increase just to help them meet their costs.
Okay, and as a member of the First Year Cleveland, you've identified that we've served over 1,300 moms. So is that how many births we had in the county in 2019?
Well, there are roughly 14,000 births in the county.
Some multiples, or does that mean we have multiples out of the 13?
I'm sorry, I'm not.
Multiple births. Do we have any twins, triplets?
Of the moms that we served,
Yeah.
I'm sure there are multiples.
Okay.
Yes, I'm sure there are. So we have enough dollars now to be at 2 birthing hospitals. We are not at all of them, so we can't address the entire universe of Medicaid births, but they are in the primary birthing hospitals for Medicaid moms, which is at Metro and at McDonald at UH. So within that, they are operating within that universe. With additional dollars, they could expand to other hospitals, but we haven't been able to give them those additional dollars yet.
And of the moms, do we have any of the have any of these been identified with our having lost, or infant mortality, having lost any children? Do you know?
I do not know the answer to that. Do we know the answer to that, if any of these moms have an infant loss? So this is Amy Geis, who's the program manager at the Board of Health. I'll let you.
Oh,
Hi, Amy.
Hi, good
If you'll
afternoon.
state your name for the record, please.
my name is Amy Geis. I am the supervisor of the Newborn Home Visiting Program at the Cuyahoga County Board of Health. Our latest statistics on the infant mortality for our program came from 2016.
No, so these are if any moms you visited had a loss of a baby. Do we know if they themselves
I do
had
not know
lost?
that specific
Oh,
data.
okay.
My
All right.
apologies.
Is
I
that-
just
is
had
that your
the infant.
Yes, yep.
My apologies.
Yeah.
Okay.
Okay.
Councilwoman Stevens.
Yeah.
Thank you. While Amy is at the podium.
She was about to answer a question you had.
Yeah, mortality.
All right, we can.
What is the mortality?
Sure.
Infant mortality rate in
All right,
Cuyahoga
I will let
County?
you answer that.
The latest statistics that I had was that compared Cuyahoga County to our program was Cuyahoga County overall for Medicaid births was 11.1 deaths per 1,000, and our program was 3.2 per 1,000.
Do you think that there's a direct relationship between the care, the follow-up care, even though it's only one visit, to help reduce the infant mortality rate?
Yes, we've identified a number of hazards in sleep areas. We provide, if needed, there's no safe sleep area, we provide cribs for them. And our nurses also have the professional discretion to make a follow-up visit if they identify a concern that they feel warrants a second visit.
Just out of curiosity, are all of our nurses RNs or LPNs, or both?
All of our nurses are RNs, and they are also lactation counselors.
Okay. You're welcome. Any questions from you, Councilman Jones?
You've actually answered most of my questions. The high blood pressure that was mentioned, was there an identification of what the reason was for the mothers experiencing high blood pressure?
Several of the moms, we've called 911 a number of times this year. I know one mom actually was off of her antihypertensive medication during her pregnancy and had been running normal, and then our nurse went in the home and identified the increased blood pressure and made sure that she stayed while she called the physician to make sure that that mom received immediate follow-up. There's been issues of bleeding where the nurse actually waited until 911 would come, and the mother actually was saved from having a potential hysterectomy because of the bleeding, and she got emergency surgery when she needed it.
I have one more question.
Councilwoman Stevens?
Thank you. How long on average do these individual visits last?
They vary depending on the mother and the situation. Usually, I would say approximately 2 hours. They have varied anywhere between an hour and a quarter to, I've seen up to 3 hours, sometimes even 3.5, especially if we're using the language line in order to provide translation services.
So they're pretty comprehensive.
They're very
in
comprehensive,
review of
yes.
care as well as the home.
Absolutely.
Okay. Thank you.
Welcome. Councilman Jones? All right, if there are no further questions, it looks like this contract was due to start at the top of the year, so I'll make the motion to move this to the full body of the council under second reading suspension. Do I have a second?
Second.
It's been moved in second. If there are no additional questions, comments, or concerns, all in favor, please say aye. Aye. All right, Council Clerk, if you'll read the next item, please.
Resolution number 2020-0037, authorizing a contract with Child Care Resource Center of Cuyahoga County, doing business as Starting Point in the amount not to exceed $3,967,988 for management and administration of the Special Needs Child Care Program.
Again, Rebecca Dorman from Invest in Children. This is our special needs child care program, which was created because we don't see them anymore. We used to see headlines in our community about children being expelled from preschool. And I think we've pretty much taken care of that with this program. It has been around now for a number of years, over a decade, and has been extremely successful. So the program is provided to all child care providers in the county to help the staff manage special needs of the children that they care for. So most of those special needs do involve behavior issues, but we also deploy nurses from the Board of Health who help with medical issues, like training child care staff how to manage seizures, for example, or developmental issues in the child as well. The Achievement Centers does that. But the majority of the issues that come up are issues of behavior, and we deploy, actually Starting Point deploys Achievement Centers, Applewood, Beechbrook, Guidestone, Hannah Perkins, Murtis Taylor, or PEP to help staff become more skilled, change classroom setup, whatever's needed to help improve how that child is functioning in the classroom. And, sometimes, quite honestly, it's more a staff issue than the child issue. So it's really, but it's been an incredible support to both children, families in the community who know that they can call Starting Point if they need help finding childcare for their child with special needs, but the providers know that we're back up to them. So yes, you need to take this child with special needs, but we can deploy all of this help and technical assistance and additional training so that this becomes a manageable situation. So children are able to be maintained in that child care setting. Parents can feel good about going to work. For example, a recent case was a child who had seizures, and Board of Health went out, trained the staff in how to manage. Child starts day one, has a major seizure, but they knew how to manage it. And so the child was able to be maintained. Most of these dollars do flow to those provider agencies, and about 1,400 children were served in 2019. They're always, our provider agencies are amazing. They always go above and beyond, and if there are additional children beyond the amount that they can bill for, they do keep serving, providing these services. Our major metric has been if the child is maintained in the child care setting 6 months past the technical assistance, and we're now at over 90% of those kids are still able to be maintained in that setting. So we see that as a big win for the community and for the kids and families. So I'll stop there, and we have Starting Point here if you have specific questions that I'm unable to answer.
Okay, so again, is there increase, decrease, or is this the same?
This is the same.
And you talked about 1,400 children being served. So in my mind, when I hear about this, you mentioned that all of the providers have access to this funding. So Can you help me follow the money? Are the children given additional dollars to be served due to their special needs, or are the providers given extra attention to be able to handle?
Yes. So the call would come in to starting point with central intake. The need has been identified. They will then deploy one of the agencies. Some of these childcare providers have long-standing relationships with a certain, especially behavioral health provider. Like they know that Murtis Taylor is who they've felt comfortable with, so that relationship exists. So you deploy an early childhood mental health therapist, actually, who would go to the center and help the staff person look at the situation, assess what's going on with this particular child. It's often issues, again, that you've heard before, aggression or self-regulation. They're concerned about if they can control, I hate that word, but control the child's behavior, and the child can control their own behavior. And so they work with the staff of the center on their skills so they can manage what's going on with the child. One of the things that did come out of an earlier evaluation was that parents wanted to know more what was going on with this, because the services are not really to the child, but the child's at the center of what we do. So we now have a form that does go back to the parents so they know exactly what's happened, what kind of assistance has been given so that their child can be maintained in that setting. So the dollars are to these agencies, to the technical assistance, and then to starting point to manage the whole system, do trainings, etc.
So can a parent prompt a call? Okay, a parent can prompt
A
this.
parent can also call starting point and get that, yes.
And it sounds like now that there are a number of individuals that can be deployed. Are we calling them agents, service providers? How are they identified?
Technical assistance.
Technical
specialists,
assistants.
I
And
would
how many
say.
are there?
Of the agencies, 1, 2, 3, 4, 5. There are 8.
So there are 8 technical assistants or 8 agencies?
8 agencies, sorry.
Okay, so how many 8
Oh,
assistants?
how many people within each agency? I do not know that number.
Ms. Osborne.
No, you know. More than 2 an agency, no? Would you
There's
say?
about 2. Billy Osborne Fears.
Thank you.
It's probably 16, probably 2 to each agency.
Okay, thank you very much. I'll open it up to my colleagues for any additional questions you may have.
I'll take one.
Councilman Jones.
Just clarity, the two, there are 8 agencies served, and through those 8 agencies, there are 1,400 children who are actually benefiting from these child care providers. Is that the term for these agencies?
If I understand your question, there are probably about 200 child care centers that are receiving this service. And there's 8 agencies that we contract with to provide those services within the child care setting.
Got you. So the 8 agencies that you kind of administer, they delivered the service to 200 agencies,
200 child care
Yes.
providers.
to child care providers.
On behalf of 1,400 children.
Got
Yeah.
you. Okay. All right, that was it. That was it, thank you.
Can I let her go back? Yeah.
Oh, we might need her. Oh, sorry.
All right, and so this is a 1-year contract. So of the 3.9 million, that is used to fund the 16 technical assistants. Are there any additional? I'm guessing some other
It's a 2-year contract?
2-year. Okay,
Sorry.
My apologies.
Yes.
Okay, and they are funding the 16. Or do we need more? Is this an adequate number?
This program certainly could serve more kids with more funding. I think we're doing a good job with the dollars that we have at our disposal. And we've built capacity over time. So, if you go out to one of those 200 year one, hopefully in year 2, they've gotten the training, they've built their skills. So next year you can serve different agencies and different staff. So I think we've raised the bar overall on quality. And we really believe that while you're out there in service of that particular child, that as you skill build and staff, all the kids are going to benefit in that classroom overall.
All right, thank you very much. Or if there are no additional questions, comments, or concerns, this too is to start at the start of the beginning of the year. So I'll make the motion to move it to the full body of the council under second reading suspension. Do I have a second?
Second.
If there are no additional questions, comments, or concerns, all in favor, please say aye. Aye. Council Clerk, if you'll read the next item, please.
Resolution number
Asked a lot of questions on this one since we didn't torture her before.
Resolution number 2020-0038, authorizing a contract with Child Care Resource Center of Cuyahoga County, doing business as Starting Point in the amount not to exceed $1,433,551 for management and administration of the Family Child Care Home Professional Development System.
Once more, Rebecca Dorman for Invest in Children. So building on this theme of enhancing quality across our child care system, this contract is to help our family child care home providers. These are licensed providers who can care for up to 6 children in their homes to help them enhance quality and maintain high quality once they arrive there. So this is a longstanding program. We have been very successful in helping providers become rated in the state's rating system. And as I mentioned last week, there is a deadline coming up July 1st in which all child care providers in the state who take public dollars must be rated in the Step Up to Quality state system. I'm delighted to say that we are very close to 100% of that goal for our community because nearly all of our home providers do take public funds in the form of the child care subsidy. So we are with the largest number of Type B home providers. We're at 92%. Who are rated, and 24% of those are highly rated. And we actually have the first 5-star Type B providers in our community, and as a UPK provider too. I think to give you some context, when Step Up to Quality was created, and when this deadline was put into effect, people were especially concerned about the home providers. Would they be able to manage this? And I have to tell you, at the state level, that home providers are now ahead of center-based providers in terms of getting into Step Up to Quality. So they have shown the doubters wrong, and we're very proud of these home providers. And Starting Point helps them overall with quality, but in particular, the focus has been helping you apply. There's a lot to go through to get into Step Up to Quality, the things that you have to submit online. And so they are with the providers, first of all, building confidence. I have to say, I think it starts there. Building confidence that you can do this. And then there's some hand-holding sometimes that goes into it, telling them when you're ready to literally push the button to submit your application. And then being there afterwards to make sure that they're maintaining quality. So we're very proud of the fact that we're going to, I think, get to where we need to be by July 1st with all the providers who really are committed to being in Step Up will make the deadline.
All right, thank you very much. Can you tell us how many home care providers are in the county?
So right now there are 424 who are under this rule of being rated. There are some smaller number who are exempt because they do second or third shift care, et cetera. But so overall, there are 447, both Type B and Type A. So Type A are able to serve up to 12 kids, but most of these providers are Type B serving 6 kids.
Okay.
There are 20. So there are 23 out of that are the Type A's.
Okay. And the, you mentioned there 24% are high rated. Can you indicate, is that 3 or more stars?
Yes,
Or-
that
okay,
is.
all right.
Yes.
Those are all, I think, all of the questions that I have. I'll open it up
Okay.
to my colleagues if you have any additional questions, comments, or concerns. All right, going once, going twice. Sounds like another easy one for you,
Oh,
Dr.
no torture.
Dermott. So, all right, so it looks like this is scheduled to start on the 1st of January as well. So I'll make the motion to move this to the full body of the council under second reading suspension. Do I have a second?
Second.
It's been moved in second. If there are no further questions, comments, or concerns, all in favor, please say aye. Aye. All right, thank you very much.
Thank
Any
you.
miscellaneous business from the committee? There being none, this meeting is adjourned.